Good evening and welcome to families of the class of 2016 and the class itself. This class has already been given a little bit of a note, as you can see on this first slide, about dressing appropriately for various occasions. And when I came out dressed as you see it on your right, I informed them that I was still the Senior Associate Dean for Students, but that they would be loath to introduce me to their parents dressed like this. So Einstein is over 50 years old, and yet this is only the fifth ceremony entitled On Becoming a Physician, or our white coat ceremony. And we're pleased that we have done it for the past 5 years, and we sort of started this following a proverb that was at least attributed to the Chinese that says the best time to plant a tree is 20 years ago. The next best time to plant a tree is today. So the fact that we hadn't done it for a long time should not and did not keep us from instituting this really quite wonderful ceremony. Since we began this, the responsibility has fallen to me to kind of put the white coat in a little bit of context so that your reverence for it may be somewhat, if not dispelled, at least tempered by knowing some things that have related to it in the past. Thanks. Next slide, Chuck. So just as you are starting out, other people started out their lives looking certain ways and dressed certain ways, and some of our faculty felt that, in fact, the first-year students had not earned their white coat yet, that they were really babies in medicine, and that conferring upon them some symbol, and this is all about symbolism, of the profession was a little bit premature. Others thought that the white coat could only and would only be used as a symbol of keeping the patient at a distance, so that you were armored and cloaked, and the patient was a different person, and there needed to be a respectful on the part of the patient, distance between the physician and the patient. Next slide. So this was the physician in the 1600s in Italy. If any of you have ever been lucky enough to attend Carnevale in Venice, you will see people dressed this way. And this person is known as the doctor of the plague. And the doctor of the plague both put on a long coat to keep from getting too close to patients with the plague, and also wore a mask that was to protect them and that they filled with nice-smelling nosegays to offset the stench that was all around them. So this is perhaps the first infectious disease physician. I, being an infectious disease physician, come completely ready to carry on the tradition of infectious disease physicians. Next. This is particularly important for white coats and students. The British have now decided that white coats are anathema and that they actually spread infection, and they shouldn't be worn, and people shouldn't even wear long-sleeve shirts. But I particularly point out the bottom of this slide where it says, a significant proportion of students only laundered their coats occasionally. It has been our experience that occasionally may be an overstatement. Next, please. But getting a little bit serious, the white coat has often been used for somewhat nefarious purposes because of the respect that it conveys as a symbol. And it's also been exploited. Next slide, Chuck, please. So here's an example. More doctors smoke Camels than any other cigarette. And that person is wearing a white coat and looking very much like a physician. I often tell my friends who know the facts that I'm not really a doctor. I just play one on TV. But this person is playing a doctor and, in fact, using that white coat to say that cigarettes, in fact, are something that you ought to smoke. Next slide. They've even introduced pseudo-statistics. 20,679 physicians. Who knows where they got that number? smoke Lucky Strike, but they don't tell you that maybe 80,000 physicians smoke Camels. So it's kind of, and they also point out that the tobacco is toasted. What they don't point out is that if you smoke enough, you'll be toasted too. Next slide. Now, in World War II, we came across Rosie the Riveter, who showed that women could do what men could do, and in some cases do it much better. So they immediately moved that concept into the physician concept, and here they show a female physician. Now that would probably be an ENT physician, but in those days, lots of doctors used those mirrors. And again, more doctors smoke Camels than any other cigarette, and in fact, more lady doctors is what that ad is supposed to convey. Next slide. And to get even more serious, of course, we know the history of doctors who played a role in all sorts of atrocities. It's why you say some of the oaths that you say at various ceremonies, including the one today, to indicate that your expertise and your position in society and your position in life should never be used for nefarious purposes. Next slide, Chuck. Here, a lot of so-called population studies were done by people in white coats to show racial superiority and racial inferiority. And in case you think that stopped and was limited to Nazi Germany, I would remind you of the nefarious and awful Tuskegee experiment that occurred in this country. And even to come further into the future in the misuse of white coats. Next slide, please. So this is Jarvik. People know his name, Dr. Robert Jarvik, inventor of the Jarvik artificial heart. And he's telling you that Lipitor lowers your bad cholesterol. However, Dr. Jarvik was not a medical doctor. He was a PhD, and that's sort of hinted at by the fact that he isn't wearing a tie and his collar is open. So that's much more PhD-like than MD-like. But they don't specifically say it. But, in fact, the AMA got up in arms that they were using a non-physician to try and sell a drug, and they actually had people pull this ad, probably because only physicians should be allowed to push drugs. Next slide, please. So this is, again, a very recent phenomenon. A war criminal, Radovan Karadzic, was found hiding, masquerading as a medical person. He had, in fact, been a psychiatrist and has been accused and convicted as one of the world's great war criminals. Next slide, please. Even more recently, physicians, American physicians, have been asked to certify that prisoners, our prisoners at Gitmo, were able to stand waterboarding. So physicians were actually involved in decisions about whether somebody could physiologically survive various things that some people would consider torture. Really a black mark on our career. Next slide. So this slide says just because, if the people in the other rooms can't read it, just because you're a doctor doesn't mean you can use the carpool lane by yourself. And he says, but officer, my ego is so large, it counts as a second passenger. And of course, he's wearing his white coat to prove that his ego is well-founded. Next slide. So we come back to this little fella. And we've decided to give you white coats, but just as he started out in short pants, we're going to start you out in short coats. So in this place, and in many other hospitals, the short coat is the sign that someone is a medical student as opposed to the long coat. But we are conferring these on you with great hopes and great expectations. Last slide, Suraj. So whether it's short or long, our wishes are, as a class, and as you have presaged in your oath, which you'll hear in a few moments, that you're going to do wonderful things in this white coat. And particularly, you can see that this white coat is laden with all sorts of gizmos, books, stethoscopes, pens and pencils, that in addition to filling the pockets with all sorts of things that I've just mentioned, you actually pay greater attention to filling the inside of the coat with someone who is knowledgeable, compassionate, professional, humanistic, and who absorbs and internalizes all of the good practices you will encounter in your time here and rejects and defends against the bad ones. Thank you very much. It's now my great personal pleasure to introduce Dr. Sten Vermund, who is a member of the class of 1977. Although I know him pretty well, I'll have to resort to reading this passage because his accomplishments are so numerous that I can't remember them all. Since graduating from Einstein, he has established himself as a leader in global health research and teaching. As professor of pediatrics and Amos Christie Chair in Global Health at Vanderbilt University School of Medicine, he directs the university-wide Vanderbilt Institute for Global Health. His extensive work in global health includes serving in numerous roles, including principal investigator for the HIV Prevention Trials Network, funded by the National Institutes of Health, that conducts HIV prevention clinical trials in Africa, Asia, and the Americas. Heading the Vanderbilt Center for Infectious Diseases Research in the Zambia AIDS International Training and Research Program, through which he works with institutions in Zambia, Mozambique, India, Pakistan, and China in a research capacity building role. And heading the Fogarty International Clinical Research Scholars and Fellows Support Center at Vanderbilt, which sponsors 100 trainees around the world each year from 22 countries for at least 1 year of mentored overseas research. He has demonstrated his innovative and organizational skills by co-founding the aforementioned CIDRZ, Friends in Global Health, LLC in Mozambique and Nigeria, the Gorgas Course in Clinical Tropical Medicine in Peru, the Sparkman Center Global Summer Institute when he was at the University of Birmingham, Alabama, and a unique South to North course in infectious disease control and surveillance at the University of West Indies in Kingston, Jamaica. For his service as chief of the Vaccine Trials Epidemiology Branch in the Division of AIDS at the NIH, NIAID, he was awarded the Superior Service Award of the U.S. Public Health Service, its highest civilian award. Over a span of 30 years, his contributions in infectious diseases, epidemiology, women's and children's health, and global health are presented in 240 peer-reviewed articles and 100 book chapters and other communications and contributions. He received his bachelor's degree at Stanford University, his epidemiology master's at the London School of Hygiene and Tropical Medicine, and his pediatrics and epidemiology doctoral training at Columbia University. He is married to Pilar Vargas, PhD, MD, also class of 1977, whom he met at Einstein in their first-year histology class. So don't just look in the microscope in histology. It's my great pleasure to introduce Dr. Vermund.